this explainer. Today, we're diving into something that literally couldn't be more urgent, the incredibly fragile state of global health security right now. We're currently staring down what experts are calling a dual crisis. On one hand, we've got the rapid emergence of some seriously lethal pathogens. And on the other, a massive structural shift in how nations, specifically the US, are responding to these biological threats. But to really wrap our heads around what's at stake here, we're not going to just look at dry models or abstract theories. Instead, we're looking at this right through the eyes of the very people standing between us and the next pandemic, our frontline healthcare workers.
Just listen to this for a second. There is a cacophony of coughing. You stop, mask up, walk in. The bright fluorescent lights of the ER reflect off everyone's protective goggles. That's Dr. Craig Spencer. He's an ER physician and a public health professor at Brown University, and he knows exactly what happens when our global defenses fail and a pathogen breaks through. Honestly, his words just immediately ground our whole discussion today. It pulls us out of that high-level policy talk and drops us right into the chaotic, harrowing, deeply personal reality of the emergency room.
So let's get right into part one. A doctor becomes the patient, surviving Ebola.
Okay, so to truly understand the gravity of today's dual crisis, we kind of have to look back at one doctor's intensely personal encounter with a deadly pathogen. It is honestly staggering how fast a global crisis can become a local emergency. So back in September 2014, Dr. Spencer deployed to Guinea with Doctors Without Borders to fight the devastating West African Ebola epidemic. He spent 6 grueling weeks treating patients in an incredibly resource-scarce environment. Then, on October 17th, he comes home to New York City and immediately starts doing this really rigorous self-monitoring. But, just 6 days later, on October 23rd, his thermometer showed a fever. Within hours, he was rushed to Bellevue Hospital. In the blink of an eye, he went from a provider fighting an outbreak thousands of miles away to becoming New York City's first confirmed Ebola patient. He ended up staying in the hospital until he was finally discharged on November 11th.
And surviving that, it required a literal army of resources. When looking back on his treatment, Dr. Spencer described the immense psychological toll of biocontainment like this. He said, 19 days in a room by yourself, other than a small window, a tiny screen, and providers who came in a few times a day dressed in spacesuits. This is so important because it really emphasizes 2 key things. First, the profound, almost unimaginable loneliness that patients with high-consequence pathogens go through. And second, the massive, resource-heavy demands this puts on a healthcare system. Just to keep one single patient alive required a dedicated team of highly trained professionals working around the clock, fully suited up in protective gear.
Moving on to Section 2. The 2026 Global Health Crisis, Bundibugyo emerges.
Now, let's fast forward from that 2014 success story to where we are right now, in May 2026. Because there is a new, incredibly urgent biological threat unfolding in the Democratic Republic of Congo. And the global landscape? It looks completely different. When you look at the data side by side, you can absolutely see why experts are sounding the alarm. In 2014, the strain Dr. Spencer battled was the Zaire strain of Ebola. And because of that massive outbreak, the whole world mobilized, right? We eventually got the Ervebo vaccine and some really effective monoclonal antibody treatments. But this current 2026 outbreak, it's being caused by a rare strain called the Bundibugyo Ebola virus, or BDV. And here's the terrifying part. For Bundibugyo, there are 0 approved vaccines, 0 approved treatments. The frontline workers deploying to the DRC today are walking right into hot zones armed with nothing but protective gear and standard infection control protocols. It's exactly like they did over a decade ago.
And to put this into perspective, as of mid-May 2026, there are already 246 suspected cases of this totally untreatable strain spreading in the DRC's Ituri province. It is escalating so fast. It's happening in a mining region with heavy cross-border movement, which means the epidemiological stakes here are just sky high.
Which leads us to part 3, dismantling U.S. health policy, a structural shift.
So here is the second half of our dual crisis. Right when this new untreatable pathogen is emerging abroad, we're seeing a massive structural shift in United States health policy. Over the last 18 months, the current administration has rolled out some major, documented policy changes. First, there's the formal closure of the U.S. Agency for International Development, or USAID, which has historically been the backbone for disease detection and aid delivery abroad. Second, the CDC took a 10% workforce reduction, along with some pretty major cuts to research grants, which directly chips away at our capacity for on-the-ground epidemiological investigation. And third, the U.S. formally withdrew from the World Health Organization. The data objectively shows that pulling away these historical safety nets leaves a massive operational vacuum. Basically, when an active outbreak like Bundibujo hits, the international coordination and surge capacity we used to rely on are just vastly diminished.
So what does this all mean for you and me? Well, Dr. Spencer connects these macro-level policy shifts directly to our own domestic security. He points out, cutting disease detection systems abroad means that we will not be able to pick up on disease threats early on. They will get bigger abroad and they will eventually come here. And he hits the nail on the head. Global health isn't just about foreign aid, it's literally our early warning system. By scaling back our international presence, we are significantly increasing the odds that these pathogens are going to cross borders totally unnoticed until they're already spreading in our own backyards.
That brings us to Section 4, the second victim phenomenon, the human toll.
So who actually bears the brunt of all this? When a deadly new pathogen strikes and our global support systems retreat, the weight of the crisis lands squarely on the shoulders of unprotected medical staff. And this brings up a really critical concept we need to talk about, the second victim phenomenon. Coined by Dr. Albert Wu, this refers to healthcare providers who suffer trauma, guilt, anxiety, and just massive rates of burnout following adverse patient outcomes, or honestly, just from working in these highly demanding, high-stress environments. When doctors and nurses are pushed way beyond normal human limits without the right institutional support, we end up with this invisible secondary epidemic ravaging our workforce. I mean, they're trained to heal, but the emotional aftershocks of treating highly lethal, terrifying diseases take an absolutely massive toll.
And you know, this psychological burden is compounded by a really stark biological reality. Healthcare workers face the absolute greatest physical danger when they are providing the most critical, intimate care to the dying. Take Ebola, for instance. Patients are most contagious right around the time of death. So the very people tasked with comforting the dying and managing their final care are putting their own lives on the line with every single interaction. And that's especially true now when treating a strain that has absolutely no known medical countermeasures.
All right, Part 5, Healing the Frontline Healers, Institutional Resilience. So if the international safety net is fraying, how do we actually protect the people who are protecting us? Well, the answer seems to lie in proactive, localized institutional resilience. We actually have proven solutions right here at home. This right here is Dr. Craig Spencer recently reuniting with the dedicated Bellevue Hospital staff who literally saved his life a decade ago. It is such a powerful image, and it really humanizes the data we've been looking at. Dr. Spencer has repeatedly credited his survival, both clinical and psychological, to this exact team. It proves that when dedicated professionals are backed by comprehensive resources and really strong institutional support, they can successfully navigate the darkest, most terrifying medical crises without breaking.
Now, Bellevue is part of the NYC Health Plus hospital system, and they actually recognized the severe impact of this second victim phenomenon and decided to do something about it. They launched what's called the Helping Healers Heal, or H3 program. It's rooted in national research, and it provides proactive, peer-led emotional first aid to staff right after traumatic events. But it's not just talk. They've also invested in physical wellness rooms across their hospitals. These are calm, intentionally designed spaces where staff can actually step away, decompress, and just process their stress. And the best part? The data shows these local interventions actually work. In a survey of their clinicians, the H3 program and wellness initiatives showed some seriously measurable, highly effective impacts. Compassion fatigue was reduced by a staggering 61%. Feelings of sadness dropped by 52%, and overall stress went down by 42%. It's pretty amazing. While we might be seeing a retreat in global health policy at the macro level, these numbers absolutely prove that deliberate, localized wellness programs are incredibly effective at keeping our frontline healers healthy and capable of doing their jobs.
Which brings us to the ultimate takeaway from this explainer. As we watch international safety nets be intentionally dismantled, and as untreatable pathogens like Bundibujo continue to emerge, we really have to ask ourselves, are we entering a new era of biological vulnerability? And if our global preventative measures are no longer there to stop outbreaks at their source, is local institutional resilience our only remaining defense against the next pandemic? It is a sobering question for sure, but understanding these dual crises is the crucial first step toward demanding a safer future. Thanks so much for joining me to explore this vital topic today.